Welcome to Facial Plastics Friday. It's Dr. Brace here, and today I wanted to start a series on complex rhinoplasty, or what I would call complex rhinoplasty, and then start talking about some of the things that make rhinoplasties complex. In my mind, there's four main things that would make a rhinoplasty more difficult, more involved, take more time, need more resources in the OR, more materials, which in the end means it's a more expensive rhinoplasty because of those factors. Number one would be revisions. These are a whole rhinoplasty to themselves because there's so many unknowns. Number two would be people with septal perforations, because this causes a whole set of potential problems and real problems that you have to deal with in the rhinoplasty, including closing the perforation. Third would be people with really small noses that want to have bigger noses. And fourth would be people with really big noses with really thick skin that want their noses to be smaller. And so those four things make a rhinoplasty not just a usual standard rhinoplasty, and they make it a little bit more involved, a little bit more thinking, a little bit more planning, and a little bit more time involved in the OR to be able to make those noses as close as possible to what the patient is desiring it look like, but with the expectation being known upfront that we can never guarantee anything in a rhinoplasty, except that I will do my best to get you as close to that ideal nose as possible. But sometimes there's on the table decisions that you have to make, which means that you're going to deviate from that final result. And then there's the healing process that we can try to mitigate and try to control, but ultimately we don't know exactly how you're going to heal. And there are some risks in that your nose may not be exactly what you hope it would be. So today I wanted to talk about revision rhinoplasty. When somebody does a revision rhinoplasty, as a surgeon, there's things I don't know. First would be how much scar tissue is there going to be underneath the skin on top of the cartilage. So how difficult will it be to open the nose? Number two is how much cartilage is left over if I need to use cartilage to put grafts into the nose in order to support it and reshape it. And number three would be what's the vascularity like in the nose? What's the blood flow like? How well is this going to heal? Now, in general, people heal well in revision surgeries, but it's not a guarantee. I've had a patient in the past who had a lot of ischemia in their nose after a revision rhinoplasty and needed to do hyperbaric oxygen. So that is a risk. And the more times you do a rhinoplasty, if it's a second revision, a third revision, a fourth revision, the risks go up for it not healing well. And if you don't have good blood flow, there's a risk of infection. So I'm going to start with cartilage. What do we do in a revision rhinoplasty where somebody has already resected most of your septal cartilage and we need another source? What we can do is we can go to your ear, because there's conical bowl cartilage in here that's good for some grafts, or we can go to the rib. I usually use the fifth rib just underneath the pec muscle or underneath the breast fold, and we take a piece of rib about 3 or 4 centimeters long, and we use that because there's an abundance of cartilage there to make the grafts that we need. When we harvest cartilage, what I'm usually trying to do is things called spreader grafts, which support your mid-vault. And when you put spreader grafts in, they do three main things. They prevent an inverted V deformity, they open your internal nasal valve, and they help straighten the nose. And so there are many reasons to think about using them, but it's always good to have the nasal valve supported for breathing. And it's always great to prevent an inverted V deformity so that as this person heals, as my patient heals, they're not going to end up with a stigma of rhinoplasty. The second thing I do with rib cartilage is often put a caudal septal extension graft in. This is a graft that goes at the end of the septum to make it a little bit longer, a little bit straighter, a little bit stronger, because often we're trying to combat a nose that's crooked, that's leaning left or right, or that doesn't have good support, and so it droops. And this is really a powerhouse graft that I like to use because it does make a huge difference in getting a nasal shape that withstands the test of time. I've played with columnar struts and other grafts, and I've found that the caudal septal extension graft really gives me a reliable result, decreasing the number of revisions that I have to do because it's such a great, reliable graft. The next place I would put grafts would be what we call strut grafts. And strut grafts are grafts that can do a couple of things. A, they can make the lateral wall of your nose stiffer so that if when you breathe, your nostrils are collapsing, this will help prevent that, will help your breathing, but it also helps to shape your nose. Because the tip we think of as a tripod, if you don't have good support on those upper limbs of the tripod, then the nose can tip backwards and over rotate, or it can lose support. And if the lateral crura of that tripod, those lateral extensions aren't in the right position, well, they can change the way the tip looks in terms of being bulky rather than being looking refined. And so I use strut grafts to be able to position the lateral crura of the nose where I want them to be able to vector them where I want them to be able to support the nasal valve. And that lets me make the tip cartilages thinner to get the refinement without having the risk of the nose collapsing. So in a revision surgery, we're often dealing with cartilage that's been resected, cartilage that's been damaged, cartilage that is broken or buckling. And these grafts are what we use to help restore nasal shape and prevent further damage to the nose. So stay tuned next week. I'm going to talk about septal perforation repair and the techniques we use for that and how that makes a septal rhinoplasty more complicated, but not impossible. But it is a whole different operation once you're dealing with a septal perforation. Everybody have a great weekend. Happy Facial Plastics Friday.